Hello, this is Dr. Routman, and I'm about to go over with you what it is you need to know if you're considering rotator cuff surgery. The overview of this presentation is what is a rotator cuff tear and why do people have it repaired? How do I do the operation? What should you expect? And what are the ways that you can mess this up? And what are the risks of the operation? First, what is a rotator cuff tear? The rotator cuff are a group of muscles that surround the shoulder joint. They work together to pull the arm in space and provide stability to the joint. And tears can impair function and cause pain. As you can see in this picture, the muscle starts over on the right, turns itself into a tendon, and attaches onto the bone all the way on the left, right near the arrows. What happens when the tendon tears off the bone is that the muscle doesn't know that the tendon has torn, so it keeps on pulling, and the tendon retracts further away from the bone. Over time, the tears can become larger. They can get so big that they can become impossible to repair. Over time, the tendon becomes softer, thinner, and harder, and almost impossible to sew together. During that time, the shoulder must adapt to this new reality of having a tear, and this can be difficult, and some people are really unable to adapt to having a rotator cuff tear effectively. How do I fix it? Well, there's a number of different ways. The traditional repair involves making an incision on the shoulder. It's a medium to large size incision in which we go through the skin and cut through the muscle and get down inside the shoulder to repair the tendon back to the bone. The way that I fix this is with what's called an arthroscopic rotator cuff repair. What we do is we make some poke holes, as you can see on the picture. Each poke hole is around 1 centimeter in size, and it allows us to use a digital camera and some high-tech tools to go inside and grab the tendon and sew it back down to the bone. Once it's been sewed down to the bone, the surgery is over, and that is the rotator cuff repair. In order to actually repair the tendon to the bone, we use suture anchors. Suture anchors are devices that screw in or pop into the bone. The tendons themselves are sewn using stitches that are attached to these anchors, so these anchors are very important to the repair. Some of these anchors are dissolvable, some of them aren't dissolvable, some of them are made of metal, most of them aren't. With experience comes reliability. This is the single most common operation that I do. I've done over 2,000 arthroscopic shoulder reconstructions, so what you should expect is that things are going to go well for you. Also to expect is that anesthesia is going to interview you and they'll let you know if you're a good candidate for a shoulder block. We love shoulder blocks. Shoulder blocks can be very helpful at managing pain post-operatively, along with the medications that we give you to help make this more comfortable. On the day of surgery, you will go home, so this is an outpatient procedure, and you will have a sling and an icing device on your shoulder when you leave the surgery center. There are fancier versions of both the sling and the icing device that are available. They're usually not covered by insurance, but if you're interested in them, just let one of us know and we'll let you know about it. On the day of surgery, and probably before that, you'll be given discharge instructions that are in writing that let you know what to do when you get home. You can usually shower in a few days, but it's not a bad idea to go home now and buy some waterproof band-aids, some rubbing alcohol, and some regular band-aids, because these are effective and helpful for allowing you to shower a few days after surgery. But that'll be made very clear in your discharge instructions. Also, it's very important that you understand that regardless of how good of a job we do repairing the rotator cuff, that you will need to immobilize your shoulder after the operation. The repair requires immobilization in order for the shoulder to heal. You should anticipate that you will need to wear a sling for 6 weeks. Yes, 6 weeks. To be exceedingly clear, if you know that you cannot or will not wear a sling for 6 weeks, please do not have your shoulder operated on, as it will be a big waste of your time. Finally, you will require physical therapy done both with a physical therapist and on your own in order to maximize your result. The duration of therapy is highly variable, from 2 months to 4 months depending on the patient, and sleeping in a recliner for the first few weeks after surgery really does make things easier for you. What can you do to mess this up? Well, the number one thing is not wearing your sling or using your arm too soon after the operation. Keep in mind that pain is not your guide in terms of when it's safe to use the arm. If we ask you to wear a sling for 6 weeks, you need to protect the arm for the full 6 weeks. Once you get to the point where you're doing physical therapy, if you do too much or you do too little, they can both have a negative impact. And finally, smoking cigarettes has a really negative impact on your ability of the tendon to heal to the bone. If you smoke during the postoperative period, the likelihood of your tendon healing to your bone is much, much lower. What are the risks of surgery? Well, any surgery has the risk of infection, nerve or blood vessel problems, or anesthesia related problems. These are all very uncommon. In fact, 93% of patients would rate this operation as good or excellent. So be confident that you'll do well. Specific to rotator cuff surgery, stiffness can be a problem. However, a little bit of stiffness at the beginning of your recovery is actually a good thing, and I would encourage you not to be too worried about getting stiff early on. Your physical therapist and you and me will work together to make sure that you don't get too stiff. Thanks for paying attention, and if you have any other questions, just let us know. Thank you.